Hi everybody, hope you guys are doing great today. Just wanted to show you a case that I'm doing here in a few minutes, a medial meniscus root repair. Once again, just wanted to remind you why these root repairs are so important, because what essentially happens when you have a meniscus tear at the root, the meniscus is pushed out from underneath the joint. So when the meniscus is pushed out from underneath the joint, like a pea being pushed out of the pod, what ends up happening is there's more stress right here at the joint. Patients end up getting arthritis, they end up getting bone marrow edema. So the goal with root repair is to pull that meniscus back underneath the knee and attach it to the bone right there. So that's what root repair is all about. That's why root repair is so important, reestablishing meniscus function. I wanted to share this knowledge with you so that if you do end up having knee pain and pains in the back of your knee, especially if you're 50 and you have a little bit of arthritis, you got to get an MRI. You cannot let people just say or attribute your pain to arthritis, because you may have a root tear, and in the end, your arthritis is going to progress rapidly. I just wanted to show you something really interesting. Once again, I'm talking about root tears. Root tears are very, very bad tears because I need to pump up. They're very bad tears because once you have a root tear, the meniscus does not function. It's a non-functional meniscus. So there's a couple of tricks. One is identifying the root tear. You got to be able to identify the root tear. It starts with history. It's always a 50-year-old. It's always a 50-year-old that missteps, or they just step hard and all of a sudden they have pain in the back of their knee. Classic history, it's always the same. And it's also the same in that the pain is always attributed to arthritis. It's not arthritis, but it will be arthritis if it's not diagnosed properly and treated properly. So in this particular case here, if we look over there, I'm inside the knee already. I'm inside the knee. This patient already had surgery, but they didn't have the right surgery. The surgeon trimmed the tear. Trimming the tear when you have a root tear does not help. It actually does not do anything, actually. So you can tell that the edges are smooth over here where the tear was trimmed. And unfortunately, it didn't help the patient. The patient's already developing some arthritis or worsening pain. So now my goal is to reattach this stump right here. Sorry about the visual is not as great as it usually is for some reason, but there we go. All right, there we go. That's the stump in the back of the knee, the stump of the posterior horn medial meniscus. It needs to be reattached to the bone, otherwise it will not work. Just like a trampoline that is broken, the meniscus will not work either. Can I get the pump up, please? Thank you. No, it's okay. Yeah, pump up, please. Pump it up. Yeah, thank you very much. Yeah. Thank you very much. So once again, if it's not attached, I want to show it to you right here, right there. If that's not attached, it's got to be attached to bone, and that's what I'm going to do right now. I'm going to do a root repair, and the message that I want to give you right now is if you're 50 years old, pain in the back of the knee that came on suddenly and it's quite severe, and you get X-rays and you get told, I'm sorry, but you have arthritis. They're probably missing the tear, okay? You got to get an MRI to get the right diagnosis. You guys take care. It's not tomorrow. We're at the end of the repair, so this is what I wanted to show you. I have these high tensile strength sutures that are locked into that posterior horn, and what I'm going to do now is tension them and bring that posterior horn up against the bone, the bony bed, and what that will do is it will secure the end of the meniscus down so that it can once again act as a cushion, or act more to recreate the cushioning effect. So that now the knee will have a cushion that will diminish the forces across it with simple walking. Once again, after more showing you a root repair, you don't trim them, you repair them. You guys take care. Thank you.